Sure, please. Okay. Yes, properly. Yes. Very good.
Am I okay here? Am I okay here?
We'll do a sound check here. 1, 2, 3, 4, 5. Good. Okay. Good morning. We're here for our regular Friday data roundup and other updates as is customary here. And I wanted to first give the podium. We have a special visitor with us today. We're proud to have with us. And first, we're going to start off and give the podium to our County Executive, Armin Budish.
Hello, everybody. Well, this is a real treat and one that I hadn't expected when we got started with these. But I first got to meet Dr. Pam Davis probably when you first, wherever you are, when you first became the dean of the Case Western Medical School, and we've known each other off and on since then. Dean Davis, you know, we do these proclamations at the county. I have one for you, Dean Davis. Our team puts these together, and as they were putting this one together, you know, it started to get to be, you know, like 10, 15 pages. You know, we only do one-page proclamations, but, you know, there was so much to include because Dean Davis has been a great leader, not only at Case, but at in our community generally. And I won't talk too long, but it's really my honor to give you this proclamation on behalf of Cuyahoga County, and thank you for all you do. And I know that you're going to continue to do in different capacities, so thank you very much.
Thank you. Thank you. I will come
Okay, I'll give it
when
to you.
Terry is.
And so as Executive Budish has mentioned, we have Dean Davis here from Case Medical School, who has been a champion of this real intersection of medicine and public health. And so I've had the pleasure working with the Case School of Medicine for many years. And people like Kurt Stenge, who's here with us, and Dr. Gullett have been, I think, model examples of building the bridge between medicine and public health, which I've always said was separated at birth, and we are amidst reunification. So let's go back 8 years or so, and in the process with Dean Davis as the dean at the Case School of Medicine, we talked about the opportunity through preventive medicine residents with some work with Dr. Stenge to provide an opportunity for the residents to have some experiential learning, and that really goes back almost 10 years now, at the health departments. And so we were able to build that bridge between medicine and health in a way that was meaningful. Fantastic people that could come in and hit the ground running on their response and really embrace public health. The kind of doctors that go by their first name because they knew that there was a way to connect back with people in the community. And so for me, it was a great relationship built to connect these very important professions in a way that really was meant to be from the beginning. And so what happened in discussions with Dean Davis is she created a population health liaison position that Dr. Gullett occupies and has been in now for almost 8 years. And in that relationship, Dr. Gullett cultivated with Dr. Stenge the opportunity to work with these preventive medicine residents. She got to meet our staff and embraced a whole range of programs in that process. And the preventive medicine residents did the same. And in the process, we built a very strong and more effective relationship. And the fruits of what we see today in our response, this combination of our fantastic public health staff here at the health department working with the preventive medicine folks from Case, was work that began 8 years ago because of what Dean Davis did and her commitment of time and the talent of her folks to the work in public health. And I think we have been much better as a community in that response for it. And so our board, in great appreciation for Dean Davis, have put together this resolution thanking her as she is stepping down as the Dean of the School of Medicine, but will continue her work, which of course began in the roots of pulmonology many years ago. She talked about her cystic fibrosis work with us. And I just wanted to thank you, Dean, for what you've done, the range of medical students that have been here, an army of medical students to help us in this response, and now physician's assistants that will be joining us. Those students will be here as well. And it's really been a fantastic bolstering of our capacity. And so with that, on behalf of our board and the community, and in support of Executive Buttigieg's resolution, thank you for all you've done. And Cuyahoga County thanks you.
Thank you. Executive Buttigieg, thank you so much.
Can't shake, but I can.
Thank you.
Very good.
And Terry, thank you so much. It's been fantastic for me to see the response to this terrible pandemic that the Cuyahoga County Board of Health, the county, and our medical community has mounted. This did not come by accident. Our research community has been a stellar research community for many years, and we have a reputation for collaboration and cooperation. I'm proud to tell you that they have pivoted. 270 people are on our coronavirus task force, looking into the basic biology, the immunology, the epidemiology of the coronavirus, and trying hard to provide the intellectual support for what we're going to do in response to it. I'm proud that our education is not just limited to the content, but inculcates values. And it was incredible, the day after this started, our medical students volunteered, probably because they admired Dr. Gullett so much, but they had learned some values as to how important it is to respond and step up in the community. And Terry's right, a small army emerged to help track cases, to make the phone calls, to use their language skills in our communities that needed those translations. And I'm incredibly proud of what our students did. And of course, as soon as our PA students heard that the medical students were doing it, they were clamoring to come, and our nursing colleagues wanted to come. So we've been very proud to contribute to the assistance here. It's always been one of my goals as the dean to advance the health of our community. I think it is incredibly important. And I hope that the fruits of long years of labor in this area that are being borne now, Cuyahoga County and Ohio are exemplars in the handling of this pandemic. I hope that shows you that we are not sitting in our ivory tower twiddling our thumbs. We are trying to make what we do relevant to the health of human beings. And I had hoped that it would not be tested in quite this way. But the fact that it is, and the fact that we have stepped up in the laboratory among our students and in the public health physician interface makes me very proud. Thank you very much for this, but this is really for our whole school, for our great students, for our fantastic faculty, and for all of our values that we've been practicing for the last 8 years. Thank you so much.
And actually, Armin, we usually have you go first with your remarks, so I think we should be customary, so please.
Good morning, everybody. It's great to be here. That was a really nice opportunity. Great to be here with all of you. As I always like to start, I want to thank Terry Allen and Dr. Heidi Gullett and the entire Board of Health for all that you're doing. As you heard from Dean Davis, this community is very fortunate to have the leadership we have in the Board of Health. And this week I got another firsthand view of how important their work is when they joined me and the three leaders from the three largest hospitals for a discussion about how to handle COVID issues in our local nursing homes. It's a great team that's working on that. Destination Cleveland earlier this week, in collaboration with the county and the city of Cleveland, launched a program, which is really a movement, called Undefeated. And it's all about the resilience of spirit that we have here in Greater Cleveland, and the fact that no matter what, we can and we will rise up again. The primary focus of that program is to help people feel safe and to be safe at our restaurants, hotels, and other businesses as they open up. I won't repeat what's already been said earlier. I just want to note that it's a very valuable program. There is a second part of the program, though, that hasn't gotten as much attention, and it's called #MyWordMyClee, where anyone can go on social media and post the ways that they are committed to bringing this county back. That can be going out to your favorite restaurant, or it can be volunteering, or it can be learning a new skill, helping a friend find a job. Go on and post whatever it is that you're doing to help us all rise up again. We all need to pull together to get through this and come through it stronger than ever. I'm very excited to be part of this movement, and I'm grateful to Destination Cleveland and David Gilbert for bringing us this program. The county's been doing quite a bit to kickstart our economy. Our Small Business Stabilization Fund is designed to help our small businesses survive. A couple weeks ago, we launched round 2 of the fund, which was $2.5 million. The committee has selected 500 small businesses to receive $2,500 grants, and another 250 businesses will get $5,000 grants. These businesses are located all around the county and in all sorts of fields of work. These funds are helping small businesses to pay rent, pay employees, and just to stay afloat while they get back on their feet. I want to thank the Cleveland Foundation for their important financial support of this fund. The crisis has affected all of us. We hear a lot about people who are unemployed and businesses closing, but we don't hear much about our local cities, our municipalities. And I know from many conversations with our local mayors and managers that this crisis has hit them very hard. And that makes sense. Just as the county relies on sales and other taxes which are in the tank, our municipalities have seen their revenues plummet as well. That's bad for all of us, because our cities pay for police and fire protection, they pay for garbage pickup, they pay for a whole lot of things that we rely on. We're always looking for ways to help our cities. The county has developed a tool that can help our cities save money, that can help them survive. The county can purchase municipal obligations from political subdivisions like cities, townships, villages, and school districts. Now, while I know that sounds complicated, but it's really not. I'll try to explain. Let's say a city borrowed money by issuing notes, maybe to pay for some specific project, roads, streetscapes, other things. A note's like an IOU. The city sells those notes to investors and pays them interest over time. The tool that the county developed allows the county to buy those notes, and the city could pay a lower interest rate to the county than they would otherwise have to pay to another investor. That was the original purpose of the plan. But in this pandemic crisis, while that's important and can be very helpful, actually, the county program that I just described has become even more important than ever and can literally be a lifesaver for a city. You see, typically, when a city's note comes due, the city would reissue a note on the market and pay off the old note. But this year, with the COVID crisis, the big institutions, the ones that buy these notes, they were not buying. Nobody was buying. That would mean that if the county wasn't involved, a city would either have to go into their reserves to pay off the note or default. And in either case, it could be a terrible disaster. Using this investment tool that the county created, the county is able to buy the new note from the city. It becomes a win-win. The city avoids default, and the county can make a modest interest rate. The county recently used this tool to help the cities of Euclid, Seven Hills, and Broadview Heights. And we can use this tool again to help other cities as well. Just give us a call. 2 county councilmen played a huge role in creating and promoting this very important program. First, I want to thank former County Councilman Dave Greenspan, who was very helpful with this when he was at the county. Once he became a state representative, Dave was able to pass a bill in the State House that enhanced our ability to purchase city notes, which makes the program even better for communities than it was before. And County Councilman Jack Schron has been instrumental in making sure that this policy is in place and that we're using it. Councilman Schron, as a businessman, understands the value of this program and has been its biggest advocate. So I want to thank Councilman Schron, who's here with me today, for all his work on this program. It truly is a lifesaver, especially in these times of crisis that we're facing. Thank you. The need is so great right now, and I want to make sure that the county's doing everything we possibly can to help as many businesses, as many governments, cities, and others, and as many people as we can. These times call for dedication and concentration on what really matters, and that's keeping us safe and getting this county back on its feet. Together, we can and we will do this. Thank you.
Thank you, Executive Budish. I think that is our challenge as we work together to address the health of our economy balanced with the health of our people. And that is certainly the central challenge for the world. So I'm going to provide my remarks, followed by Dr. Gullett, and then followed by our co-director of Prevention and Wellness, Ramona Brazil, who has a very important message to share with our community. So Governor DeWine released important news at his press conference this past week. So in response to the continued presence of COVID-19 in our long-term care facilities across the state, we've heard that our Ohio National Guard is assisting with a statewide plan to expand testing in nursing homes and other congregate sites. Guard members will work as members of a congregate care unified response team, along with medical personnel and state and local public health officials. So there'll be teams that will be deployed across the state. The Guard actually began its testing recently at the state's 8 residential developmental centers. Testing will be prioritized at nursing homes where exposures to COVID-19 have occurred, or where there is current activity beginning first with staff and then moving on to residents. It's important to folks to recognize when we're concerned about community transmission. If we have staff that are going into facilities, potentially having been out in the community, potentially exposing folks in those facilities, the staff may go home, they may go out to other community sites and potentially other jobs, and then start new chains of transmission in the community. And so starting with staff is an appropriate place to begin and working through these efforts. The governor said that Ohio's goal is to conduct testing over time in all of the nursing homes. We also heard that the governor announced an expansion of the criteria for testing, working with the Ohio Department of Health. There have been 3 major areas of priorities to date that we're familiar with. Priorities tied with, and have been tied, continue to be tied with symptomatic people that are hospitalized, people like healthcare workers, behavioral health providers, home health workers, emergency medical technicians, folks working in nursing facilities, and a range of other concerns in congregate facilities. We also are concerned about first responders and public health workers and critical infrastructure workers, people that are working in places that provide our telecommunications, handle our treatment of our sewage, and provide clean water for the community, a range of those critical. We also knew in priority 3 we have essential surgeries and procedures that are beginning in an outpatient fashion at our hospital facilities, so these folks are also being tested. The announcement that we heard about from the governor now is that a 4th priority area has been created and is for individuals in the community to decrease community spread, including individuals with symptoms who do not meet any of the above categories. So with this expansion, we're dealing with symptomatic citizens in the community that we can now expand testing to with the state's priorities. The governor said that expanded testing availability will allow individuals in lower risk tiers to be tested and help to further contain and respond to COVID-19 in Ohio. We anticipate that this guidance will continue to be reviewed and revised as we move forward in the pandemic response. If we go back a month or so ago, we had very limited testing. We've seen an expansion of testing sites at pharmacies in the community. Information on these new sites is available on the coronavirus.ohio.gov website under the Testing Community Health Centers tab on the website. Beginning June 8th, facilities for residents with developmental disabilities and assisted living facilities can allow visitation in outdoor settings. Each facility is required to design and implement its own visitation plan based on considerations such as available space, number of visitors, and staffing capacity. The governor noted that each facility's plan must include the following elements: screening of visitors for temperatures and symptoms, scheduling hours and time limits for visitors, proper social distancing measures, face coverings, providing residents, families, and visitors with education about the risks associated with COVID-19. We realize that there have been many sacrifices made during the pandemic as families have been separated from their loved ones in order to keep them safe. We all wish it could be different. No one wants to see the introduction and spread of the virus into these facilities. We have seen the devastating impact of COVID-19 on our seniors. We have to be patient during these gradual transition and return to visitations. We must always put safety first for these vulnerable residents. We know, and myself many times going to visit my mother at home who's almost 80, she says to us all the time, and my brothers and sisters, I wish I could give you a big hug. And so we recognize that urge will happen as folks go into these facilities to spend time with their family members. We ask you to be safe for their sake, for everyone's sake. I wanted to talk a little bit about our call center, and as we do that, I'd like to ask the cameras to shift because we're going to go to the slides, and we'll stay there so you won't have to shift back. The slides that we'll have brought forward that will include Dr. Gullett's comments as well. So what you see up here, first our report on our call centers from our phone bank that really began. Oops, I'm sorry, I'll pause. I did not allow time for station identification here. We'll pause. Oh, good, thanks. We'll reset. So what we have here is a graph that shows, a bar graph that shows the calls that we received through our call center really since early March. It represents 9,200 calls to date and counting. And so we've had staff in that call center running Monday through Friday on a wide range of needs that have been presented by the community. Lots of concerns that were represented in the community, and I think that it's important to recognize that we knew people needed somewhere to call, that people needed to describe the concerns that they had. This virus is new. This is a pandemic situation, and so I want to thank all the folks that have manned those call centers and the stress and anxiety and concerns that have been expressed, they've often been on the other end of those calls. And so I thank them for their patience and their commitment. And so as we transition, we can talk a little bit about those calls and some of the details. So we've had a range of sort of domains in which these calls have come from, and they have resulted in almost 1,900 complaints that we followed up with specifically. So you have a range related to general calls about COVID-19, the essential service designations, a range of complaints about whether people are following social distancing requirements, using personal protective equipment, proper sanitation in sites, concerns that may relate back to nursing homes and a range of other clinical settings, school-related questions about openings, about plans related to schools, mass gathering concerns, some of the issues around testing and antibody analysis that we've been hearing about in our reports, symptom discussion, personal protective equipment and the like, and so reopening issues and quarantine and release questions from isolation and the like. So these calls have come in, and we're going to continue to man the center to meet those needs, mostly in the domains around essential and non-essential businesses, and complaints and general questions have occupied most of the calls and time associated with our staff. So I wanted to share these and thank them. Our folks in environmental health are out in the field every day on response. And we know that we need to be particularly vigilant as more businesses open up and more settings go back to providing service in the community and people interact in those settings. It's important that they follow the safety procedures. What we don't want to see is outbreaks expand in community settings, the way that we've seen concerns and cases in these congregate facilities. We have to remain vigilant. There are lives in the balance. So with that, I'd like to transition to Dr. Gullett, who can provide our weekly data roundup. Yeah, the cameras will stay where you're at there.
Good morning. As we begin to talk about the data today, I just want to take a moment to pause and recognize what a profoundly painful and difficult week this has been for our entire nation, but particularly for African American communities across this country, and ours is no different. And my colleague Ramona Brazil will talk in a few minutes about this issue here as it ties to our national issues, and also we continue to remind everyone of the issues of equity that come into play, the issues of structural racism that have been a problem in this community and many others since the founding of this country, and which you're seeing play out in the data that I will present and that you're seeing in hundreds of other communities. So it's really important that we call this out very specifically, and Ramona will provide more information in a few minutes. I will end today with my moment of gratitude, which I usually start with, and then we'll flow into Ramona's comments. So we'll have the cameras stay where you are until I give you the thumbs up to change. We don't want Heather to be cut off. All right, Kevin. So I begin this morning with our Cuyahoga County Board of Health jurisdiction numbers. These include all of Cuyahoga County except the city of Cleveland. Our colleagues there are separately reporting their numbers, but we continue to work very closely with them on a daily basis. Lab confirmed cases, 2,493. Probable cases, 570. For total cases of 3,063. The date of illness onset is February 28th to May 26th. Transmission continues robustly in our community. That's a really important message today. We've all got to continue to do our part because this virus continues to transmit, as you can see here with dates of illness onset. Our recovered cases, I am very pleased to say, are over 1,000. We have been celebrating every 100. Well, we celebrate every single one. But every time we get to a new 100, we as a team, we cheer. And we're now over 1,000, which is phenomenal. But we won't stop until we have everybody through this in our community. Number of identified contacts continues to rise at 4,896. And sometimes people move from the contact numbers into the case numbers. So anybody who was a contact that became a case, we no longer count them as a contact. They're listed in the cases. The age range for our cases is 1 week of age to 102 years of age, as compared with the state where it went from 1 week to 109 years of age. The median age for cases here is 51 years old, and 57% of cases are female and 43% male. Total hospitalizations at any point during the illness course are 465, with only one of those being pediatric thus far. Again, these are for acute infection, meaning current infection. These don't represent any systemic inflammatory disease syndrome cases that we've heard about in pediatric populations. Intensive care unit admissions are at 130 adult admissions, and these range from several people in their 20s all the way through each decade. We have not had any pediatric admissions for intensive care. We began last week presenting you with cumulative counts, and so in red you see our increase in cases since the very beginning each week, which represents the transmission that we're seeing. This includes probable and lab-confirmed cases. The total deaths are in green, and you can see as they continue to rise, and the total recovered cases are in blue. And again, these numbers always are lower than what I give you at the beginning because we have to cut off our data for analysis a few days before the press conference. This is the first time you're seeing this analysis, but we've been asked a few times for the increase in the number of cases each week. And we wanted to show you this so that you can realize that we've had the largest number of cases, the largest increase in cases since this all started week to week. I'm often asked how many cases we had since the prior week, which we always post the numbers, but this doesn't, you don't have to do the math now. And graphically you can see that we had a significantly more number of new cases than people who have recovered from infection. And then 30-ish range for the last month or so. We remain around 20% for the number of cases that identify as healthcare employees. About 10% of them are hospitalized, which is a little, so far, which is a little higher than I reported last week at just over 9%. We still have almost, a little over a quarter unknown, which we continue to interview people. So this, we continue to get new people and update their status. But this information comes mostly from our interviews. And then pre-existing conditions, about 43% of individuals' cases identify with pre-existing conditions. About a third of our cases, we still don't know that information, and we get that again from interviews. When you look at the hospitalized patients, over 80% of our most recent analysis of the hospitalized patients have a pre-existing condition. This is for all cases, not the hospitalized only. These are our racial and ethnic breakdowns, and I have the graphical representations in the next slide. But this is for all cases, lab confirmed and probable together. 1.7% of cases identify as Asian, 40% Black, almost 40% white, 3.5% identify as other, and we have 8% of our cases this information is unknown, but we're still seeking it. For ethnicity, 2.5% identify as Hispanic or Latino or Latina, 75% non-Hispanic, non-Latino, non-Latina, and 22% unknown. This is a harder demographic for us to get. I personally do a fair amount of calling myself, and for a number of people, they're not used to reporting ethnicity. So we're often explaining what that means and gathering that information as we do the case interviews. And so we don't get that often reported on the initial lab report, which is why it's a little bit higher unknown, but we're still seeking that information. So this is the same information in graph form. We want you to be able to see it. We want it to be accessible to our community in every way possible. I won't repeat it because I just reviewed it in detail, but it will be on our website shortly after the press conference. This is the racial and ethnic breakdown for recovered cases. 56% identify as white, 34% is black. We have 6% unknown, 3% identify as other, 2% is Asian. And the ethnicity is 82% identify as non-Hispanic or non-Latino in our recovered cases. For hospitalizations, this is all cases. Earlier I referenced just healthcare workers only. For all cases, you'll see 46% that are hospitalized at any point during their illness. 46% identify as white, 45% as black, 5% as other, 1% is Asian. You'll see that this is a different distribution than our total cases. A higher representation of African American individuals are hospitalized as compared with the full case count. 80% of those hospitalized identify as non-Hispanic, and 3% identify as Hispanic, Latino, or Latina. ICU admissions continue to show the same trend over the last few weeks, with more African American or individuals who identify as black in the percent of ICU admissions. 48% of ICU admissions identify as black, 45% is white, 5% is other, and 2% is Asian. 84% of ICU admissions identify as non-Hispanic and non-Latino. And I think the ethnicity data represent that we actually haven't had a significant amount of testing in communities where people identify as Hispanic, Latino, or Latina. And that is a focus of our equity group, along with other populations in our community who have not yet had widespread testing. As I move on to the fatalities, I again want to pause. These are families. These are grieving families. These are families, many of whom themselves are infected with COVID-19. So please continue to support them as best you can, socially distanced and not transmitting the infection anymore, but recognize how very painful this experience has been for them in not being able to grieve in the way that we normally would. We have 186 deaths in our jurisdiction, 174 lab confirmed, 12 probable. Dates of deaths extend from March 20th to yesterday, May 28th. The age for these deaths is 36 years of age to 101 years of age. Median age for deaths is 81, with nearly 54% female, nearly 46% male. We have one unknown case for the sex. We do call every single one of these families, but sometimes they need time to be able to talk to us, and we understand that. And so we continue to seek all the information we can, but in the most respectful way. So you may see some delays in the death demographics, and that's why. The racial and ethnic breakdown are here. Again, the graphical representation is to follow. Asian, 1.1% of our deaths, nearly 24% black, just over 67% white. We still have 7% unknown race for our deaths, and 85% are noted to be non-Hispanic, non-Latino, and 0.5% Hispanic. Still about 14% unknown ethnicity for the deaths, although that continues to go down as we continue to gather more information. This is the same information in graph form, and again, it'll be on our website shortly. This is the same graph we show every week, and it precedes our epi curve, which will be coming in one moment. So So this is our new epi curve, and you heard me talk last week about how the curve has gone kind of up and down a bit. And it's not that classic one hump curve. And what we think is that we have a lot of ongoing transmission related to different clusters, related to new interactions with reopening. And what we see when this is not just one big curve that then comes down is that the models predict higher numbers of cases rather than when there is a curve that looks like the preceding slide. So what that means for our community is that every single person has to do their part. We need people to wear cloth facial coverings or masks. We need people to please do social distancing. We need extensive cleaning regularly, especially on frequently touched surfaces. We need folks to please listen to guidance from establishments where they're customers or where you work. This is really important in seeing the epi curve that we have week after week. The next slide is the map we share with you each week. This includes the city of Cleveland cases. So this includes lab confirmed and probable cases, and it includes both local health departments in this county. And it continues to show where people who are cases live, where they identify as their home address. And again, a lot of people are cared for in our community. A lot of the testing data you're going to see in a minute represents people who are tested here, but who may live in other communities, and so they may be reflected in a map in an adjacent county or 1, 2, or 3 away. This is the county level hospital utilization, and I will show you the trend data again on the next slide as I did last week. Our medical surgical unit is increased utilization 3% from last week. We're at 73%. Our pediatric medical surgical utilization has increased 5% and has steadily increased to a point of 57% utilization currently. But again, we've only had one pediatric hospitalization that's acute COVID related. Critical care adult beds utilization decreased 3% from last week, 74%, and ventilator use decreased 2% to 31%. Individual hospitals have reported some increase in cases over the past week, and we certainly have had a significant increase in lab confirmed cases, as you saw in an earlier slide. But overall, when you look at the hospital utilization, I pull the numbers for this press briefing once a week, and I'm comparing you week to week. So there could be some intermittent variation, but this is sort of what we've seen week to week for a few months. The trend is shown here. In gray at the top, you see critical care adult beds. They have trended slightly up, but down just a slight bit this week. In blue, you see the adult medical beds. I earlier talked about pediatric medical utilization being up, but that does not appear to be reflective of acute COVID infection in pediatric patients. And ventilator usage peaked at 55% in early April and has remained around 30% since then. And the number of ventilators available is pretty stable. It bounces around a tiny bit week to week, maybe 10 or 20 ventilators reported total different week to week, but it's relatively similar. And finally, this is the testing data. We've been trying to gather this for a while, and we're trying to report what we can, what we receive. We don't get negative test reports, so it's very hard for us to understand who is being tested total. We only get positives and indeterminants, meaning they're not positive or negative. So our hospital partners have been working to try to give us total numbers to help us understand the testing picture. And we're incredibly grateful to our county executive and his team for enabling us to do more community testing, which has significantly increased in the last 2 weeks. But what you see here is the total testing for all 3 hospital systems, not including the labs that support the Rite Aid pharmacy drive-through, as well as other ambulatory practices. For example, LabCorp and Quest do some testing in our community. Those are not reflected here because we don't receive those numbers. So if you see, last week we had actually reported out a higher number of tests And when we received new data this week, we realized that that report was incorrect. And so we've corrected it for last week. So 2 weeks ago, we had 14,000 tests. Last week, it was a little higher, nearly 16,000. We had received information that it was higher than that, but we wanted to help you see that actually this week is a little bit lower. And so only about 13,000 tests this week. As we get more information, we'll be able to graphically trend it for you, but this has been one of the hardest pieces of information for us to obtain week to week. We're hopeful that going forward this will be a little bit easier to give you information about who's being tested and where. We have no data around the addresses of these individuals unless they're positive, or their race or their ethnicity. So we're hoping to get those kind of information so that we can actually target testing to the people who need it most in our community. The overall percent positive this week is about 7%. The range from different labs is anywhere from 6.5% to nearly 9%. And that just represents the number of positive tests compared with the total number of tests done in that lab for the week. So Terry reviewed the testing priorities earlier, so I'm not going to review those again, but we'll pause for a moment and allow the cameras to reset, and then I'll transition to my colleague Ramona. Oh, wait for the thumbs up. Okay. Good. Okay. So I'm going to end this morning with a moment of gratitude, flipping it up, changing it up a little bit today. I just would like to thank the tireless colleagues here at CCBH who work really hard on our equity programming normally, but also have now helped devise a whole equity strategy for our agency. This is work that goes long before, as you've heard me talk about before, long before COVID-19. But in the time of COVID-19, actually a group has come across our agency together, meets multiple times for multiple hours a week to devise messaging, to devise our testing strategy, and to ensure that everyone from the most vulnerable to every citizen in our community receives the care and the testing that they need at the time that they need it. And Nichelle Shaw has been leading this for us. She has taught me so much about equity over the years, has been a huge partner in our HIP Cuyahoga movement. But I wanted to recognize them publicly because particularly this week, this calls out for all of us to do something different in the way we think about caring for our community and caring for everyone in our community who perhaps have not had the same opportunity as people who look like me. So thank you all for the work that you do. And with that, I'm going to transition to Ramona.
Good morning. First, I would like to start by sharing a great resource with our community. The Cleveland Heights University High School District has been chosen as a site to receive 200,000 pounds of fresh produce to give to the community. The program is made possible through Produce Pack, which received a grant from the USDA Farmers to Families program. The district will distribute each week 2,000 20-pound boxes of fresh produce like apples, potatoes, carrots, onions, and strawberries for free. No documentation or paperwork is needed, and people can drive up and receive their boxes in their trunk. They can also accommodate people who walk up or ride up on bikes. People can pick up the boxes on the next 4 Thursdays in June, including the 4th, 11th, 18th, and 25th. From 11 a.m. to 1 p.m. at the district's high school, which is located at 13263 Cedar Road in Cleveland Heights. And we will also share this information on our social media pages. So next, I would just like to share a quick story about when I first started working at the Board of Health. I was originally hired as a case manager, providing education, resources, and assistance to families with children with elevated blood lead levels. I remember the first home visit I ever made, 18 years ago. It was to a grandmother who was caring for her 4 grandchildren, ranging from ages 2 months to 7 years of age, one of whom had elevated blood lead levels. When we sat down at her dining room table, the first thing she told me was that they did not have enough food. Instantly, I knew everything about that visit had to change. Lead was the least of her problems. I knew that if I didn't hear her, if I did not work to find her food and address their hunger, then nothing that I said about lead would be heard. I learned that day that I had to understand the person or the community's priorities if I was going to address the health issue that was my priority. So in that vein, today I would like to acknowledge the difficult week that the African American community has had. Bernice King, daughter of Martin Luther King Jr., said this week, it is traumatizing to be living through a global pandemic and living through the viciousness of racism at the same time. The community is reeling, and I am reeling too. We cannot address the disproportionate impact of COVID-19 on the African American community while not acknowledging the pain the community is feeling. We talked before about the impact of racism on health, and today I would like to discuss the connection further. Peer-reviewed studies have shown for people of color, compared to their white counterparts, even in early childhood, normal childhood behavior is identified as behavioral problems by preschool teachers, and children are expelled from childcare at higher rates. That's something that locally our partners at Starting Point have been working on for probably more than a decade. In schools, children of color are disciplined more severely for similar actions and are over-identified as special needs and under-identified as gifted or talented. Beginning in the preteen years, boys of color are seen as more aggressive and older than they are, and girls of color are seen as less innocent. As adults, people of color receive more severe criminal sentences for similar offenses and have less access to optimal health treatments. And in the time of COVID-19, people of color are less likely to be able to work remotely and have less access to paid sick time. What this leads to is a constant fight, constantly fighting for yourself, for your family, for your community. And people who are worried about having enough food, safe housing, community violence, and fair treatment live under constant stress. Stress has both mental as well as physiological impacts. When someone encounters a stressful situation, their body reacts with the fight or flight response. We're all pretty used to hearing that, and we think of that about adrenaline commonly. During that stress response, heart rate increases, blood vessels constrict, blood pressure rises, and breathing rates. When the stressor goes away, another system then works to bring down all those body systems back to normal. But what happens when that stress is chronic? The body constantly works with higher levels of stress hormones. Chronic stress has been linked to the development of heart disease, high blood pressure, diabetes, and it weakens the immune system. It also leads to poor coping mechanisms like smoking and dietary choices. Racism is a contributing factor to chronic disease and chronic stress, and chronic stress contributes to the development of chronic disease. Chronic diseases contribute to sicker and shorter lives. While we are not able to speak in generalizations yet about our COVID-19 data, we are seeing higher rates of hospitalizations and ICU admissions in African Americans. We know that people with pre-existing conditions like heart disease, high blood pressure, and diabetes are at more severe risk of illness from COVID-19. I understand sometimes people who do not need to think about their race do not understand its significance for those who do. I can't explain the omnipresence of the weight of racism for people of color. It's always there. I also understand that some people don't understand the importance of public health, and myself as a public health worker, to discuss racism as an important social determinant of health. Maybe it's too uncomfortable to hear, and maybe it's too divisive, and maybe it's too political. But ultimately, public health's responsibility is to work to improve the population's health, and we cannot do that when we ignore root causes of poor health. So, what's the answer to address differences in health outcomes, such as chronic disease, infant mortality, and outcomes in COVID-19? It will take, and continue to take, and many people have worked on this for many years here, a significant community commitment and investment in what contributes to health, like good jobs, quality education, fresh and affordable food, safe neighborhoods, healthcare, and justice for all people, no matter their race, gender, sexual orientation, income, or place where they live. So I just like to end in just being grateful for the support of our medical director, Dr. Gullett, and our health commissioner, Terry Allen, to address these issues head on. Our agency has done a lot of personal work, both heart and head work, over the last decade to be able to talk about these issues and to understand our role in advancing equity in our community. So for those who would like to learn more about our community's equity efforts, more information can be found on our HIP Cuyahoga website, which is www.hipcuyahoga.org. And with that, I'll turn it back to Terry.
Thank you, Ramona, for that heartfelt and courageous speech that you wrote. And I think it captures the moment in a very important way because of the stress that white folks might and can understand to the degree that African American folks are dealing with on a daily basis. It results in unnatural causes of death that are unfair, unjust, and are disproportionate. There's a work that's being done by Dr. Tom Leviste, who is the dean of the Tulane School of Public Health, and he's working on a project called The Skin You're In. And he talks about the differences in life expectancy, outcomes, and opportunity, and disproportionate early death and levels of chronic disease that are faced in the African American community that persist and have persisted for decades. What we're seeing very poignant here in the COVID response is that, in particular, higher rates of hospitalization and intensive care unit time for folks in the Black community. We're also seeing that the frontline workers, the essential workers, are often people of color that are in low-wage jobs, who are in multiple low-wage jobs on the front lines to provide critical services for us, and therefore more at risk in this response. And we need to acknowledge that and what that means and what that commitment means and the differences in opportunity that exist for a fair wage and access to health care and many opportunities that folks take for granted. So I want to thank you, Ramona, for your presentation. And also acknowledge Ramona. She talked at the beginning. She's a mother. She's a student for another advanced degree. She is a professional here at the agency. And I know that her husband is part of the work around dispensing the fresh fruits and vegetables at the University Heights, Cleveland Heights School District. And so It's a way to promote onions for your kids, apples, oranges, healthy vegetables. I used to tell my kids that broccoli was like an elephant walking through the woods eating the tops of trees, and it worked for a couple years actually. So I just want to thank you for what you said and for having the courage and to lead and take this moment that we have with everyone paying attention to this COVID work to talk about something that is having a central impact on our community. So with that, I think we'll take some questions.
So I know for the priority groups that were discussed with testing, previously, I think in that second priority group, along with the people who live in congregate living communities, etc., it was also include people of color who have these pre-existing conditions. So can you talk a little bit about testing that group in particular, and if this new fourth priority group is going to include more people of color who are in these situations where they're disproportionately affected?
So the question relates back to the priorities, and among the priorities is a focus on vulnerable populations and also ethnic and minority communities. And the question relates back to the testing that we've done and will do. How will those testing opportunities be afforded to people of color, and also with the new priority that ties back to anyone with symptoms, how will that work ahead impact opportunities for testing? So in the commitment that the county executive made, working together with the Cuyahoga County Board of Health and Metro Health, there will be a commitment to do up to 30,000 additional tests in the community that we've reported out. Different environments where we are reaching vulnerable people, including people of color. And that includes homeless shelters, folks that have developmental disabilities, group homes, recovery, and Pastor Vernon to conduct testing among symptomatic folks that are among his congregations. And we intend to continue to work with in other settings to reach minority populations going forward. What we hope to do is to identify ways to reach people as we can in larger groups, and we're working with actually our informatician, Gu Oyang, is building out a opportunity where we can have people register online as we create these events. There are limitations to how many tests we can do a day, and so we're trying to focus on trying to schedule out over a course of 2 weeks in advance a range of settings that will include reaching people of color and other vulnerable populations in a variety of these settings that we've described. What we're also happy about is there now is an increased number of testing sites in the community from pharmacies, along with testing that's happening with symptomatic people in the hospital systems. Metro's telehealth line has given an opportunity for people to call and get free service if they're symptomatic, and then also be linked to care. So I see an expanding opportunity to reach more people of color in the weeks ahead. We've begun to do it now, and it is essential that, given the data, that we continue to focus on that, and we're committed to do that. Thank you. Yes, Victor.
Given the fact that seniors are disproportionately affected, and obviously nursing homes have been kind of a prime candidate for coronavirus and deaths, what are the concerns as the state looks to loosen the restrictions as far as visitation and other regulations in nursing homes?
I think the concern is that as we start to work in this first tier related with assisted living, for instance, is that if they look for outside gatherings, is that the concern would be people aren't wearing masks, that there is close contact between the residents in those facilities and family members, people hugging, kissing, potentially transmitting the illness unknowingly and unintentionally to the people they love. Concerned about how that transmission could then move into a facility among residents and staff. That is the biggest concern, and certainly what that can do, as we described, can create new chains of transmission that people did not intend. And so we're asking people to make some sacrifices, continue to make some sacrifices, and follow the guidelines. They work. They have worked. The social distancing and the physical distancing, staying socially connected, the pieces that we put in place with the stay-at-home order helped to reduce and really dampen down the curve to date. Our real concern here in public health now, across the country as we open up, is that in a variety of these settings, including places now where people begin to mix together, and we know it's hard when your grandmother is looking at you through the window, or in some cases they're not even able to do that you want to see them, and you want to tell them that you love them and that you care about them and make that connection, particularly in those late years, and have the best opportunities to spend time with them. But we have to do it safely because it's about them. It's not really about us in many cases. It's about them. And so we need to make sure that we recognize when we're wearing a mask, and I wear a mask, and I'm with anyone here, I'm showing respect to you because I'm wearing a mask. And when you wear a mask, you do the same for me. And so we need to think about this as a point of respect. So I really would say that's our biggest concern. And we do hope that people remember that in the moment as they connect in different ways with their family members in those facilities.
I was hoping you and Dr. Golan, whomever, could speak to the new graph that we saw this week. I'm not quite sure what Dr. Golan said, but we've had the most cases this past week. So the crisis here is more than it was a month ago when it felt like we were in the heat of things.
Yeah, so Courtney's question is about the increase in the number of cases week to week. So I know several of you have asked for that over time, just to make it easier to report on, how many cases do we have this week compared to other weeks. And our goal was to give you something that didn't require you to do the math as you're busy writing things up and getting this information to the community. So we're sharing that to show that the weekly increase in numbers, this is the biggest weekly increase we've had since the pandemic hit our community. And I think it's a reflection of, we do have more testing now than we have in the past. The last few weeks, obviously, you've seen it bounced a little bit, a few thousand tests up and down the last couple weeks. But if you compare that to March and you compare that to April, we did not have a lot of testing then. We still are trying to get more and more testing. I mean, we have a great increase now with our county executive and his team giving us those resources, but it's still trying to get them rolled out. We still have a limited number of tests per day that the labs can actually physically run, and so our teams are mobilized, Metro Health is mobilized, the other hospitals are working with other groups to mobilize testing, but it's still not, where anybody and everybody can come and get a test and we can run 15,000 a day. You heard our governor talk about wanting to run 22,000 a day. Well, we have enough machines per our government. Our state government officials are saying we have enough machines, but we can't run that many tests in this community daily. So I think you're not necessarily seeing a reflection of it was that much worse now because we couldn't test people back then, But it is, the takeaway point is this is a significant issue for our community. It's going to be for many months, and we cannot let up. We have to continue to protect each other, continue to protect those most vulnerable, and continue to prevent new transmission. Prevention is the key to getting us all through this safely, and we've got to do every single person their part, every organization their part. We're all trying to do this together. So that's the main point for today as far as that graph. I just wanted everyone to see it. You can calculate it yourself if you look at our slides going way back, but we thought it would be helpful.
And just talking about everybody doing their part, driving to different assignments, running to the grocery store, corner stores. Tons of people aren't wearing masks out and about. Tons of people are passed it on the west side of town, standing up in close proximity, drinking at bars, restaurants. Is there any way to combat that as a community, or do you expect that to see, are we going to see a lot of spread in the coming weeks because of those actions?
Yeah, so Courtney's follow-up question is that she's personally witnessing a lot of people not wearing masks and not social distancing, and are we expecting to see increased cases? I would say if that sort of thing continues, yes. I personally have seen the same thing myself. I try to model the best behavior I can, and I'm always wearing this and always trying to stay socially distanced. But I know a lot of people, maybe if they haven't been affected yet by it personally, maybe don't realize how serious a risk it is. But we had a 36-year-old person in our community die this week. This is very serious. We've had 184 people die in this community. We've had several dozens of people die across communities in this entire state and across the nation. This is very serious, right? We really have to stay foot on the gas, not letting up. We've got to stay ahead of this. Do you want to add something?
I would add, if people are in the community and they see concerns about social distance or other concerns that they have, to call the health department. We can work and have been working in the complaint responses and taking calls from the community where concerns arise. And business owners will work with us. As you know, the masking for the public is voluntary. Some businesses have chosen to require masks for people entering their facilities. We think that's a great practice. We think it helps to reduce the risk for transmission. But the guidance that has been put together across a range of settings is meant to reduce the risk for transmission. And so the guidance is meant to be followed. The governor has said that for restaurants that are not following the guidance and creating risk in those environments, they want to hear about those situations. He went as far as saying that if people continue not to follow the rules, that their liquor license could be at risk. And so for me, it's important that we hear about those situations. We believe, and certainly with the work that County Executive spoke about in efforts to try and acknowledge people who are exemplars in the community, that are stepping up to protect their patrons, to protect their workers. We think that that is a great example, and we believe that most people want to follow that. And so we want people to recognize that they need to be part of this equation to reduce risk. And as Dr. Gullett said, we are a long way, folks, from being out of the woods. We're a long way. And as a community, we have to embrace this because nobody wants to see another death reported up there. Nobody does. We'll take one more question.
Yeah, maybe a follow-up for Dr. Gullett. The number of cases has increased, perhaps because of increased testing. And as far as the number from last week to this week, as far as deaths, what was that? And is that in line or consistent with the increase in cases, or is that remained flat? Or
Yeah, so Vic's question is about the increase in fatalities or deaths as compared with the increase in the number of new cases. So the graph that we shared shows the increase in the number of deaths per week as well. But I wouldn't read too much into the week-to-week increase in deaths reflecting the number of cases because reporting of deaths and fatalities always lags behind. In some cases, we're notified immediately upon someone dying, but sometimes, and you saw Dr. Gilson talk about this before, we work closely with his team, but they don't receive every fatality report. And so sometimes we get reports from death certificates, and we had no knowledge of this person in the community prior to that. Sometimes there are people that we've been calling for quite a while, and we cannot get them, and we later find out that it's because they're deceased, but we found out at the time of their expiring that they were positive, but it wasn't notified as a death. So I would be a little cautious about sort of projecting that this is a reflection of the number of cases. Like I said, our testing is more than it was in March and April, but it's not substantially more this week, and we have substantially more cases this week. So I do think it's a reflection of people venturing out of their homes more and being interactive more. We have gotten, as you know, the governor has asked employers to report to us when there are positive cases in their staff, and we get daily reports of employers that have positive cases, and so that's not a new area, but it's an increasing area of cluster for us because people weren't out working unless they were essential workers before. So we're seeing now pivoting our cluster response strategy to reflect more community clusters and less of the congregate facilities we had before. We're still working all of those clusters, but we're changing our approach in that now we have a whole nother area of folks that are cluster investigations that were closed for, 8 weeks or however long that their business was closed. So we'll continue to report. Okay, sounds good. Thank you.